We've seen flus before, but we've never seen a flu like this. We've had outbreaks before, but this one has topped the list. Airports locked down, schools, places of worship locked down, private offices, government offices locked down right across the world. Have you ever seen anything like this? The droplet-borne virus originated in China and forced citizens to abide within the confines of their homes. This meant businesses had to close their doors. The unprotected cough or sneeze of an infected person easily passes the virus onto those within reach, as with all cold or flu infections. But this virus easily claims the life of an elderly or someone with chronic illness or compromised immunity. So it became very important for persons to keep away from the public in order to avoid getting the virus or spreading it. Travel helped the virus make its way to quarters of the world. It became clear the whole world would become affected, and the frenzy began. Consumers started going after the necessary products like a wildfire. In no time, masks, gloves, sanitizers, alcohol, vitamin C disappeared from shelves right here in Jamaica and in big cities abroad. A rush of fear and excitement took over the whole world. We cannot think of another outbreak that brought this level of excitement to the entire world at once. The strain of coronavirus originated in Wuhan City, China in December, and the country's New Year celebrations would not be the same. Travel was prevented, keeping families from getting together, and the New Year celebrations were cancelled. By January, the epidemic forced citizens within their homes to contain the spread of the infection, and we saw videos of Wuhan's people singing with each other from their apartment windows, encouraging each other to keep going. Little did we know Wuhan's story would become the story of other cities. Now we see similar videos from cities across Italy, Iran, and America. The World Health Organization is concerned that the COVID-19 spread is accelerating. I personally think it's amazing to find something that simple hygiene practices could prevent is getting out of hand. As simple as covering a cough or a sneeze, regular hand washing, making sure hands are clean before touching the eyes, nose, or mouth when you need to. These simple practices we fail to carry out as adults. These are habits that should already be a natural part of us as adults, then we teach them to our children. It's such a shame we fail miserably to carry out these practices. Too often we see a grown up just throw a cough out. No effort to cover, no consideration for others, no care, nothing, just throw a cough out. Now there's an epidemic, spread accelerates. There is no vaccine for COVID-19. We need to take as much care as possible to secure our health, and it is important to stick with the guidelines laid out by health authorities. Also important to stick with the facts provided by health authorities. Stick with the facts and be careful of fiction, because there's plenty circulating out there, plenty that is not helpful at all. Some of you might have heard, for instance, the suggestion to mix hydrogen peroxide with vinegar for an alternative when Lysol disappeared from shelves. We later learned that the combination produces a poison. It is not sound advice. The very person who made the suggestion pointed out that he had years of experience in pest control. He did not forget to mention his field. The hydrogen peroxide and vinegar mixture likely would be helpful in keeping pests away, but not ideal for safe sanitization as Lysol would be. So it is very important to stick with the facts provided by health authorities. There is no vaccine for COVID-19. In America, efforts are being made to come up with a drug to fight the disease. Federal government is funding studies on a number of drugs, and hydroxychloroquine is not one of them. Yet President Trump announced hydroxychloroquine as a promising possibility. This was misleading and unnecessarily raised his people's hopes in a drug that is not even being funded by federal government. If COVID-19 is bad enough already, do we trust our leaders to make things worse? Amid the pressures and the expectations, a leader must pull through and pull through well. What the president must realize is it is after COVID is over, he will need to make America great again. We see the kind of impact COVID-19 has, the piles of dead bodies in the hardest hit countries, and we ask ourselves, is this coronavirus another biological weapon? Perhaps some measure geared toward population control? We've seen anthrax and plague bacteria go to work. Biological weapons have been used since ancient times, harmful substances employed to take the life of an enemy. This kind of warfare proved effective because it was both deadly and inexpensive. The microbes that are used are chosen because they are deadly or will incapacitate. They are contagious, easily transmitted among humans, and there are no vaccines readily available to treat them. Some other possible weapons were smallpox, pneumonic plague, viral hemorrhagic fever, and cholera. This kind of warfare would, of course, easily subdue an enemy. Of course, there's a ban on biological warfare. If COVID-19 is a weapon, there are logical questions that arise. Who is the user? Who is the target enemy? Or what would be the ultimate gain in using the virus? If population control would be the ultimate gain, how come the most vulnerable are the elderly who are not even of childbearing age? We just never know, do we? What we do know is there are organizations out there with their minds set towards certain aims. Their ruthless plots materialize in all manner of ways. Many times we are victims of their exploits. We are victims of atrocities. The more COVID-19 increases, the more cases health facilities will have to deal with. Doctors and nurses are out there on the front line, and we don't know how scary their job might be right now. A number of them have lost their lives in the line of duty, even as they try to save their patients. The thing about the modern world of medicine is, equipped as it is with all its tools and gears, it cannot alter the fact that one human mistake can lead to devastating results. We hope and trust we will only see a limited number of these results. Here's to health workers on the front line. Does the Bible prophesy of this corona outbreak? Someone has pointed to Isaiah 26, verse 20, as prophecy of what we're experiencing now. This is what the verse says. Come, my people, enter thou into thy chambers, and shut thy doors about thee. Hide thyself, as it were, for a little moment, until the indignation be overpast. The fact that the verse says, shut yourself in for a while until what's going on has passed, persons think it speaks of the situation we are now experiencing. But I don't personally agree for three reasons. First, it says, come, my people, suggesting that it is God's people who will shut themselves in. But people all over the world who have been or are being quarantined are not just God's people. Many are atheists, non-believers, the worldly. It's not just God's people who are shutting themselves in. My second reason is it says until the indignation be overpast. Indignation meaning God's wrath. COVID-19 is not the wrath of God. It is not any action from the hand of the Almighty, just like all outbreaks before it, some of which were actions from man's own hands. The verse that follows speaks of punishment for the accountable. And this is the indignation that verse 20 refers to, which brings us to my third reason. When God begins to act to cleanse the earth of wrongdoers, he will need his people to shut themselves in to keep from the face of his wrath. This is similar to that time in Egypt when the angel of death passed over Egypt to slay the firstborn of the Egyptians. God needed his people to paint around their doors with the lamb's blood, but he also needed them to shut themselves in while the death angel passed over. This Isaiah prophecy will be a similar thing where God will act to cleanse the earth of wrongdoers, and he will need his people to shut themselves safely in until after he has completed the cleansing. COVID-19 has presented unique challenges, the greatest of which is the economical impact of the global lockdown. Loss of revenue, production decline, loss of income, and loss of produce are facing individuals, businesses, and nations. Among other challenges, increased deaths and the question of how to deal with infected dead bodies are concerns for some places. Isolation in quarantine is a stressful experience for many. Persons who have lost their work routine are finding it difficult to fit themselves into staying at home. In some territories, the police has to be involved in enforcing precaution guidelines. Some parts of Africa are having difficulties getting food even when it is delivered to them. There are tourists, visitors stranded abroad after becoming unable to fly back home. How do they eat? How do they get by? And plenty lies in uncertainty. Activities and events suddenly put on hold without any clear idea when they will pick up again. All of these things are going on at once. This is where COVID-19 has the world right now. We need to keep our minds strong, maintain good health, and work with the flow. One day, COVID-19 will be behind us and we'll return to normal life. Stay strong. Mankind will always be mankind. We are resilient. We bounce back after every fall. The First World War, we bounced back. A Second World War, we bounced back. The recession 12 years ago, we bounced back. We survive by making the best of the resources we have and conquering obstacles with a determination that lies within our genotype, naturally part of who we are. And we look forward to tomorrow with hope, just like every generation of mankind for 6,000 years now. COVID-19 will come and go, like all difficulties before it, and we will rise strong once more to work toward our dreams and goals and reach horizons that are yet to unfold. Stay strong, and like they say in Wuhan, add oil, keep going.